Welcome back to CBS This Morning. In our series, Vaccinating America, we look at who will be next to get the coronavirus vaccine. The CDC recommends the next 2 rounds include older adults, essential frontline workers, and then other essential workers. Some doctors say wealthy patients have offered to buy their way to the front of the vaccine line. Adriana Diaz looks at the debate over who should get the shot.
Every day that it's not offered to them is another day that they're putting their lives in undue harm.
Anthony McGee says who gets vaccinated next is personal for him. McGee, who works for the union that represents Chicago corrections officers, says he's seen the virus take the lives of 5 guards and sicken 700 more.
Why do you think that corrections officers in particular should go before police officers or teachers?
There's additional risk that your typical police officer who arrests someone and then they're done with them. Our people here have to sit with them day in and day out on a regular basis.
A CDC study found that of all occupations, corrections officers are most exposed to COVID-19.
We strongly believe that our members should be considered in the early stages.
He's not alone. Groups around the country are jockeying for position. Among them, bankers, Uber drivers, aviation workers, even zookeepers. The CDC recommends the next round of vaccine distribution, called Group 1B, includes those 75 and older and roughly 30 million frontline essential workers like teachers and first responders. Behind them, Group 1C, people 65 and older, those with high-risk conditions, and around 57 million other essential workers. But how to define those essential workers and the order in which they're chosen is determined by each state. The Kaiser Family Foundation found that as of last week, 30 states were still developing more specific criteria for the next phases of distribution. Richard Morocco is the president of New York's Hotel Trades Council. His union is lobbying state officials to prioritize hotel employees.
The hotel industry has transformed during this pandemic, housing individuals traveling from out of state who are considered to be high risk, but also because hotels have converted to alternate uses like housing COVID positive patients.
There have been some reports of higher net worth people trying to pay for the vaccine. Have you experienced any of that?
Oh, yes, absolutely.
Dr. Ehsan Ali is in private practice in Beverly Hills. Many of his patients are celebrities. He says several dozen people have offered to pay him to cut in line for the vaccine.
It's not ethical to be offering money to get the vaccine. People are just used to being able to get their way when they have privilege and wealth.
Dr. Eileen Marty is an infectious disease specialist at Florida International University.
Every step of the way of getting the proper amount and the proper people who are most at risk vaccinated eases everything for our society. It comes closer and closer for us being able to go back to normal.
A normal that will no doubt be new, but that can't come soon enough. For CBS This Morning, Adriana Diaz, Chicago.
You know, it's surprising to me. We're in the 3rd category of essential workers. And at first I felt really guilty. And then I think about how many people we interact with and you kind of take a breath. With people paying for it or thinking they can pay to get it, you're
I'm
like,
not surprised
where's the
that wealthy
empathy?
people would try to game the system when we're trying to vaccinate our grandparents, those in need, essential workers. It's really terrible. And I hope it doesn't happen.
It really is up to the states to make sure that it's fairly distributed.
Yeah.
Yes,
for those who
absolutely.
definitely want to get it.
I'm happy being under lockdown, Tarika. I'm happy.
I know you.
I will let everybody go because I've been doing the
You're
social
very
distancing.
passionate about it.
I really am.
We respect that. Thank you.